Good afternoon, everyone. Thank you for being here. Let's get into some data. We currently have 349 cases in Onondaga County. That's up from 322 cases yesterday. This has been a trend that we've been seeing for the past week now, about between 20 and 30 new cases a day. This morning we had our fourth resident of Onondaga County pass away due to the COVID-19 disease. This is a terrible disease. It impacts people in different ways. It comes on strong, it comes on hard, and those in our community who have health issues that contract this disease have a hard time. And certainly we're thinking about our neighbor and their family who lost their life in this case, and our other neighbors this week who are no longer with us. These families can't mourn the way they should be able to mourn because of this. And that's something that we're cognizant of, and one of the ways that this virus is impacting us as we go through this process. So we're going to pray for them as an Onondaga County family, obviously. In addition to that, we have 29 individuals that are in the hospital. 14 of these individuals are in critical condition. They are in a fight, and we need to pray for them as well. About our hospitals, I'm reporting every day about Onondaga County cases in our hospitals. Needless to say, we've been talking about our hospitals are the backbone and backstop for the entire region of central and northern New York. What do I mean by backstop? If you live in Oswego County and you go to the Oswego Hospital, or Cayuga County and you go to Auburn Hospital, if those hospitals have constraints, where do they go? They go to our hospitals here. If you're in the North Country, the same thing. So we are in the heart of the region. We have the medical infrastructure to really lead, and our hospitals have been leading, and I want to thank them all, St. Joe's, Crouse, and Upstate, for all the work that you've been doing, your staffs have been doing. You've been doing a tremendous job. Certainly when we look at central New York, in northern New York as a region, we now have close to 900, if not over 900 positive cases. And so I think these are sobering numbers, and as we in this community continue to plan and prepare, we're not just planning and preparing for Onondaga County surge capacities. We're looking at central New York and northern New York as a region. One person has been released from the hospital since yesterday, so that is some good news. Today there are over 100 people who have recovered and are released from mandatory isolation. So our active cases are now at 245 active cases. We've talked about our two curves, one being positive cases that will always add on to new positives every day, but active cases are the ones that we're really monitoring now. Once you recover from this, what does that active caseload looks like? When does that curve start to flatten and hopefully go the other direction? Out of our 349 cases, 39 of them are contacts. What's a contact? A contact is usually someone who is in the same home as one of our positive cases. Part of the uptick in our percentages of those being tested has been that the contact cases have gone up. Did we expect this to happen? Of course we did. If you're living with somebody, they come down with COVID-19, they were symptomatic, you didn't know you had it, there's contacts, that's going to spread easier. So that is something that certainly we've talked about and we have expected in this process. There are 189 female cases of COVID-19 and 160 male cases. 10 individuals are under 19 years of age. 76 of individuals are in their 20s. 55 are in their 30s. 52 in their 40s. 62 in their 50s. 51 in their 60s. 28 cases with individuals in their 70s. 13 cases with individuals in their 80s, and 2 in their 90s. 25% of the cases are under 30 years of age, 40% are under 40, 55% are under 50, 73% are under 60, and 27% of our COVID-19 cases are over 60 years of age. Breakdown by municipality: City of Syracuse 120, Clay 37, DeWitt 25, Camillus 23, Salina 23, Cicero 22, Manlius 20, Onondaga 19, Pompey 15, Geddes 11, Lysander 9, Skaneateles 8, Van Buren 4, Lafayette 3, Marcellus 3, Atisco 3, Tully 2, Fabius 1, and Spafford 1. Related to testing, we've tested over 4,672 individuals. Testing has been robust, and we've been testing people who are symptomatic based off of guidelines given to our medical professionals. We've not been testing people that don't have symptoms of COVID-19. So we've had 349 positives. That means we've had 4,323 negatives. That's an interesting number. That's a big number to think about. There's been 4,323 people who have been sick, but they've been sick with something other than COVID-19. Yesterday, between this time today and yesterday, we've received 238 tests back, and we still have about 478 pending tests. Some of those pending tests aren't for our county, but we anticipate, around 400 tests in Onondaga County are still pending. What do we know about that? What we know is based off of the averages, between 7 and 7.5% out of 400. That means we probably have 28 cases of positive COVID-19 there, and we can start to make these assumptions. And so what you look at the strategy that we've had as a community: test, identify, treat positives, quarantine those that may have been in contact, and then spread with social distancing. So how do we become successful and flatten the curve? We need to continue to test. That's what we're doing. We need to continue to quarantine. That's what we're doing. We need to continue to social distance and look at policies that can help us starve the virus, and so we flatten our curve. The quicker we flatten the curve, the better and easier it is to start our economic recovery and start to really make the case that we need non-essential businesses to reopen, and we can start that conversation. We are not there yet. After the positive result, the health department's going to reach out to you. You should also hear from your primary care provider if you have one. The health department will start a rigorous investigation looking at where you've been since you've had symptoms, what kind of contacts have you had. They'll reach out to your employer, understand who potentially was working with you, and through that, the health department then decides who should be quarantined, and in any gaps in that investigation, that's when we come to you, the public, and ask you for your help or alert you to a time and place where someone was positive with COVID-19, and did you have any potential contact. That's how that process works. Out of this, we still need to really emphasize common sense. And what is common sense? If you're sick, no matter if you're essential or not, you need to stay home, okay? We can't have cases where people are sick, they're worried about what's going to happen at work, they're fighting something off and going to work anyways. That cannot be the case. There has to be zero tolerance for that. If you're sick at all with any symptoms, you need to stay home. This is becoming an issue with some of the cases that we're seeing. There are very, very demonstrable cases now where individuals went to work and they were sick and they shouldn't have gone to work. So if you're sick, you're worried about what your boss is going to say or whatnot, you think you might be treated unfairly, stay home. If you're getting a hard time, you call my office and we'll work with the employer. We cannot have sick people going to work. Let's talk about the release from isolation. We're talking about the recoveries. We know as we continue to test, that means there's a demand for testing. As that continues to happen, we know we'll continue to have positive cases. In most of our cases, for positive cases, everybody's going to recover. So let me go through that process, because we need your help in this process right now. We have set up a online password protection application process where individuals who are recovering can input all the required information regarding their health status. If you've tested positive, please take advantage of this online application. This will help expedite the release process from isolation for positive cases. Again, Dr. Gupta and their team now have guidance on what they need to see to release by going and utilizing this online tool, by continuing to text message if you're a positive case with our health department, what your symptoms are. This will help expedite that process for you. A reminder for our positive cases: once you are released and deemed recovered, only our health department can tell you that. That is not obviously a free pass to go out into the community in ways that you haven't for the last 2 weeks. Certainly, we are social distancing. We need people staying at home regardless. So please keep that in mind. Looking at this as well, again, we talked about communicating with our health department. We have more and more cases. We are going in more and more investigations. The turn times and the communications becoming more difficult. Let's utilize the technology. Let's be patient. For those in a quarantine, let's continue to be available to answer the calls when they come. In some cases, people are checking in on quarantined individuals. Certainly, that's being done for the community safety and for your safety. So please, everybody, we just need to continue to be patient in this process. I know it's stressful, and everybody feels that stress. If you've been sick or you potentially could be sick, we're here looking out for you and for your neighbors and your families. So let's just continue to be patient. We're doing a good job, but these are all reminders. Our plasma project with Upstate, that Upstate is going on, the Red Cross, they've gotten great response. So we want to continue to market this for all of our positive patients. If you're interested in this research project with Upstate, please contact them. Certainly, this is part of the research in dealing with this disease, this virus, and you can be part of the solution with this as well. So we've had over 100 people who have tested positive want to take part in this, so that's fantastic. I want to thank you all for that. We've recently, with social distancing, we're talking about how the community may be asked to do more. We're looking at data, and we're looking at ways what that might look like. We're not prepared to really talk about that today, but we are seeing some of our businesses starting to implement some common sense measures about who's coming into the box stores and the grocery stores related to how many people per square foot. That's important. We want to continue to encourage our essential businesses to really be mindful about foot traffic in your buildings, but also your employees and the safety of your employees. Many of your employees are anxious and they're concerned. They're coming to work every day because they're essential, and we need you to continue to operate as a community, as a society. But anything business can do to ease that anxiety with their employees, whether it's giving them masks or anything else, please consider doing that. Related to masks, we've talked about this. We've said we think it's a good idea if people want to wear a mask when they're out in public. We've said that the N95 masks are part of the famous PPE. Governments don't have a surplus of these masks, so we can't provide the general public with them. But there's a lot of individuals starting to make their own masks, their own cloth masks, and so we encourage people when they're out in the public to wear one, and that's smart. There's nothing, there's do no harm in wearing a mask. That makes sense. Other countries have done this CDC is now recommending that we do this. So certainly in Onondaga County and Central New York, I think it's in everyone's interest to wear a mask if you can get your hands on a mask. Okay? And Dr. Gupta is busy on investigations. She is in full agreement with that recommendation. She wanted me to highlight that. Our upstate triage hotline, 315-464-3979. If you are in a position where you don't have health insurance, you have symptoms, you're sick, you call the triage hotline, you get screened, we get you tested. If you are in a situation where your primary care provider may refer you to this hotline as well. But that's what that is for. Our seniors, our healthcare worker and adult nutrition hotline, the number is 315-218-1987. This is a hotline which is dealing with getting people meals, getting them basic food, necessities, as we have new populations in our community that are being asked to really social distance to different extremes. And as we've gone through this process, there's been gaps and there's been need, and we're pivoting and we're addressing that need. Certainly, I want to thank all of our volunteers who are delivering meals today. Our county legislature was out delivering meals today. Thank you for doing that to all of our members who got out there and their staff, really giving back. So I want to thank them. Child Care Solutions, 315-446-1220. What is this? We knew early on we would have daycare challenges. Our essential businesses, their employees would need to address daycare and to make sure that our medical infrastructure, our emergency management infrastructure, our essential businesses continue to operate for the rest of us. So this is free daycare for the month of April for people, whether you need it every day or you find yourself in a bind for 1 day or 2 days. Please take advantage of that. Donations of PPE, 315-435-2525. Why are we asking for donations of PPE? Is because we don't have a stockpile of PPE. We need PPE. When our emergency management department gets it, what do? They do a needs assessment with all of our emergency management providers, all of our healthcare institutions, our various nursing homes, and these are the N95s, these are gloves, these are protective face guards, certainly other protective equipment as well. So if you have some of these, you come by some of these, you're a business, you're a medical facility that is not operating right now because you're doing essential or non-essential surgeries or elective surgeries, please reach out to us and give us what you have. It will get put right back into the community. So I want to thank people for that. And again, we talk about the mental health challenges that we're all seeing throughout this process. Anxiety, it's real. It's real for people at every age. Parents, you're doing a great job, especially not letting kids go on play dates. You've really done a great job. I think our numbers reflect that with positive cases. When you look at our under 19 demographic, we've done very well. We're very pleased with that. But it continues to be a challenge. We ask our parents, when possible, and I know it's not possible all the time, to not bring the kids to Wegmans or Tops or wherever you're going to groceries. That creates anxiety, more contact, human contact. Sometimes it's not possible. Sometimes mom has to get something and there's nobody to help, and we get that. But when often possible, please keep the kids at home. That creates anxiety. If you need help, contact 211. We have mental health providers there who are willing and obviously ready to talk to you to think about various different strategies to help get through that. Saying that, we can take some questions.
Workplaces and people going while sick. Any other connecting the dots you've been able to do in the last few days in terms of how we're still getting cases when we've implemented social distancing and all these other policies?
Yeah, I think. Well, I think it's here, right? And so you test, you identify, you investigate, you quarantine, and then that starts its process. When when you don't have real-time testing, you're always losing time, lagging time. When you have individuals going to work sick, which we now know in this new batch of cases that we've had, we know that there's been people who've done that. Then they potentially expose multiple people. Then you kind of start over. We talk about it. Your margin of error is zero to really flatten this curve and then get it going in the right direction. And our goal is to have more recoveries each day than we do positive cases. As long as the virus is here, we'll always have positive cases. But if we slow that down and we have more recoveries, we'll be in a pretty good position. So how we kind of track where this is going, Doug, is, we look at the data. We're getting enough data as far as testing goes now where you can see different trends. Lots of testing, lots of positives, right? Then we had a fall off on testing demand for a week. We still get more positives, but it's going at a smaller trend than this past week, and that demand for testing has increased this past week, not to the point where it was in the beginning of this process, but it's higher. So, as long as we continue to see 400 pending cases and tests every 48 hours, we know we're going to see 28 to 30 positives. So then we have to identify them quickly, see who they've had contact with. Based off those contacts, we know we'll have more positives. So that's the cycle. So we're very anxious in looking at some of the new testing capabilities and when they might, rapid testing, when we might be able to do that and get our hands on that type of capability, because that would allow us to test, identify at once, catch more people that are positive quicker, so that we can work to flatten the curve. But certainly things in our control, we are seeing cases that are in our control. If you're sick, you have it, or if you're sick and you have something else, you shouldn't go to work anyways. If you're sick with something, you can spread whatever that is. That's not good. So those cases that we've seen like that, and for me to hear about it, I don't hear about the specifics, but for me to hear that this is happening means it didn't happen once, okay? So we just need to hit that home and reiterate that. You can't, if you're sick, you cannot go to work. And if you're worried about something with the employer or whatnot, and you have symptomatics, you go get a test. Even if you get a test back and it's negative, we'll work with your employer to make sure there's no retribution.
Is there a dominant trend to that? I mean, in terms of workplaces, home parties, what sort of?
Yeah, look, right now the things are happening so fast. It's tough for us to connect all the affiliated cases. There are affiliated cases. At one point, we had a little bit of a lag where early on they could identify 8 cases that were affiliated, not contacts, but affiliated. I'm sure that number is a lot higher now, and I'm sure you have certain cases that multiply with various affiliations. We would love to get there, but right now the quarantine numbers, the investigations, I mean, you're talking between 20 and 30 new cases a day right now, and we know that that's what we're going to have in the foreseeable future until the testing demand slows down.
What are your thoughts on the governor announcing that he's bringing in ventilators from China and Oregon?
I think that's great, and I think the ventilators is communities are trying to get them because they think they're going to need them, right? And so the state needs them. We get that. We're part of the state. We need them. We have very sick people. We've lost people. So it's great to see Oregon sending over, I think, 150 ventilators. China, I think, was sending over 1,000. I know that in the marketplace there are ventilators that I know that the state's probably buying. The challenge for other communities that are seeing strain at the local level is when you're going into the marketplace to buy PPE, you're really third in line. FEMA, if they want it, can intercept. The state can intercept number 2. And then if they don't intercept, you're there. So there's an expectation from these larger governments that local governments will be out buying these materials for their community. That's what we were elected to do. And how do we verify that expectation exists? In the federal stimulus bill, the community development through HUD, Onondaga County received about $1.3 million of things spending that can be related to COVID-19. One of the things that we can buy is PPE and ventilators. So certainly the federal government is anticipating that we should be trying to do this ourselves. We talked about yesterday, there was a lot of questions about PPE. We highlighted the fact that when it comes to PPE, I just don't think we were being talked to yesterday, because the state is giving us PPE because we're asking them for it. So why would they give us PPE one day and ask for it back the next day? And so this is an ongoing process, and it's been tough. We're putting out orders, not because we want to spend money we don't have budgeted, but because we need to make sure our nursing homes and our hospitals have this. Our hospitals are ordering things, and that's getting intercepted from FEMA and from the state. So this is a competitive process when you identify goods at a price that is reasonable, and then what you put in a larger order than you probably need for that week, because quite frankly, there's two larger governments out there that are going to intercept some of that, if not all of it.
And do you think that, I know you were just talking about the PPE, them asking for it, do you think they'll do that with ventilators too, or do you think that we're pretty much set up?
Yeah, I had a conversation with the governor's team this morning about that, and look, I've said this from day one. They're over here in this chart that shows really a region of over 1 million people where our hospitals support that. That's the healthcare region of central and northern New York. Those hospitals are located here in our county. So when it comes to testing for COVID-19, we've supported that region and beyond. And when it comes to the medical infrastructure, some of these communities have smaller hospitals, but they're seeing surges in their numbers. As they see their surges, those hospitals aren't going to be able to take all those people. They're going to come to us. So my conversation is, I think the governor's clarified his position a little bit more on ventilators today. They weren't going to send the National Guard into communities to seize them. But my position is we have already positioned ourselves to service this whole region. If we have a ventilator not being used today, that doesn't mean it won't be being used next week. But if you have sick people in demand right now, and you want us to work with Orange County or Nassau, Suffolk, the Capital District, which is seeing a surge in their demand, let's do this in a planned fashion. Let's not disband the infrastructure, our equipment, all over the place, because we'll never get it back in time that we need it. And a check does us no good if I go to try to buy. I'm trying to buy ventilators. If I can't buy them because the other governments are getting them, giving me money does no good. So we have an infrastructure here. It's working well. If we need to bring in more people into that infrastructure right now, that's something that we can absorb and puts our community at less risk, because certainly our numbers are going up in Onondaga County, and they will continue to go up, and our numbers as a region continue to go up.
Has there been any more discussion with employees, medical staff going downstate from here in Central New York?
Yeah, I think so. There are certain cases where certain hospitals are looking at sending some employees to different hospitals. I know SUNY Brook on the island has a unique relationship with upstate, and they're talking about potentially sending some medical staff there. And I know that the VA is its own network. They've sent people there. So certainly any hospital that's sending some staff is doing it mindful of this data. We have models and algorithms that are looked at hospital by hospital and as a region, trying to predict where this is going. And we know that we need to keep our infrastructure strong, because this is not slowing down next week. And what we see is people needing this infrastructure and people getting sicker. And at some point in these smaller communities, they're not going to be able to handle the surge of COVID-19. And the numbers may not look like a lot. Okay, so 100 cases in a small county. Oh, that's 100 cases. Look what New York City has. They got thousands of cases. But you got to look in population, compare them to populations. And that's where I think you can look at data differently. But the percentages of positive cases in these larger communities, if you have 10 million people, that might be the exact same percentage with thousands of cases as it is for 100 cases in a small county. So that's how we have to look at that, per capita cases by population, when we're looking at 911 situations across the state.
Just 24 days ago, we were still reporting that there were no cases confirmed in Onondaga County, and now there's close to 400. What would you say to people who still might not be buying into this social distancing part of this?
Yeah, I think for the most part, people are, but the challenge with this is if it just takes one person not feeling well, going to work, and having contact with 25 other people, and we get setbacks. And I think that's what we've seen. And so what do we then do as government, right? Because we continue to test, to quarantine, to heal, but then we have to distance. So what happens is we have to look at other ways to try to impact on social distancing, to give everybody more time to look at a medical solution to this. The reality is, if we have to, looking at the timelines of a vaccine, if we have to wait that long, we're going to have big, big problems, okay? So, some people are suggesting that this may travel like the flu into the southern hemisphere in the next few months. That would be great. But if we do our job here and we really buy into this, we can probably flatten the curve well before then. And then we can get back to normal in a recovery. But the longer people don't buy into social distancing and people are starting to worry about their own situation, right? Am I going to get laid off? Am I going to get furloughed? Those are real issues going on. And we need everybody to buy in, because if that does happen, and that's happening to our residents, the stimulus unemployment numbers are helpful. They're better than what they have been in our history. And there's stimulus checks coming to most people, but that's going to get you through 6, 7, 8 weeks. This thing's got to be over in 6, 7, 8 weeks, or else you're counting on another stimulus package, which we don't know will happen. So what can we do as a community? We can social distance. We can buy into this. This is no joke. There's 4 people over the last 2 weeks that have buried their loved ones. And for many of those people, they couldn't even pay their final respects the way they wanted to. This is no joke.
Have you personally been tested, or Dr. Gupta been tested?
I have not been tested for COVID-19. I've had no symptoms. I have not been sick. Knock on wood, Doug. I don't know if you're trying. I don't know if you're superstitious. If this is what you're trying to do to me here, but I will get tested if I get sick. Okay, I'm not going to waste a test on myself, and I believe the science, and we'll stay with that. I don't know if Dr. Gupta has been tested. I doubt it, because she's been with me every day for the last month at least, and she's in excellent health as well. She's been washing her hands 150 times a day before COVID-19, so we're all just catching up with Dr. Gupta.
I haven't heard any reports, but are there any confirmed cases in the jail system in the county?
I haven't heard. I don't believe so, Doug. That's something I would have heard about, and so we've taken really good steps in both jails and our detention center, our juvenile detention center, on visitation, and that's how that would happen, right? You get visitation in, or an employee coming in. And every day, to your point, Doug, I take my temperature every day before I come to work, and before I go into my emergency operations center, I take it again before I go into that station. So that's what all of our employees are doing. Again, hence why we're getting frustrated with people who are, every employee at an essential business should be doing that every day. If your temperature is approaching 100 degrees, you stay home. And so if everybody did this, we wouldn't have some of these cases, and some of these cases we're getting now are leading to new cases. Because we know with contacts, we're going to have them, right? We know that contacts now, for every case, it looks like 310 cases generate an additional 12% of contacts, right? So that's, that's a challenge. Other questions? Go. No good news? I mean, I know Andrew's not here, Adrian.
What's the good news, Ryan?
Okay, so look at on our map. I don't understand this yet, but on our map, Elbridge and Onondaga Nation have yet to have a case. We'll knock on wood. I know it's easier to do social distancing in Elbridge than other places in the community, but I want to thank everybody in those communities, and I want to commend the Onondaga Nation and our health department. They have been working in a very proactive way together, collaborating. And again, we're not just serving all of central and northern New York. We're also working with another nation, literally, in the Onondaga Nation. So that's good news. Thanks.